What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, a flu test, RSV, pneumonia, anything, hopefully you have tested negative and not positive. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, December 15th, 2023. First off, if you're new to my channel, welcome to my channel. This is where we do the daily pandemic update. Sometimes it's data filled at my computer screen. Sometimes it is out here in the wild, out in the dangers of the wild, I should say, at this point, because things are getting dangerous right now. Levels are really high. More on that in a moment. If at the end of this video you like the video, give it a thumbs up and subscribe down below. Maybe you've been watching this for a few days now and thinking, you know what? I'm starting to like this content. Maybe I should subscribe. Just do it. Hit the subscribe button down below. Alrighty, starting off today, we do have several notes that I have for you today. First off, let's start off with this, and this is not a good thing. COVID-19 cases and deaths are climbing once again in U.S. nursing homes as vaccination rates don't hit new highs, but hit new lows, according to a new AARP analysis of federal data. We've been seeing this. There's been a lot of news stories back in the fall. Now we're about to enter winter where vaccination rates are low, but that's not just for the regular people like you and I. I've had my booster, had the Novavax booster, but now there's problems with people not getting boosted in nursing homes. I don't know whether they're refusing. Maybe some of their loved ones are saying, you will not give my mother or father a booster. No, I do not want them to have the booster. And it's not really required anymore. There's no mandates. I mean, no one's requiring staff or no one's requiring the residents of the patients. So, yeah, it's a real problem. And it's pretty much sky's the limits for the nursing homes now as well. Anyone and everyone can go visit. Not many of them are requiring masks. And the ones that are requiring masks are because, well, they're currently having a COVID outbreak. It's not good. Nursing home cases and deaths, as it says here, is going up, and it is a real problem. Now let's go to Canada. Up in Alberta, Canada, 36 Albertans have died from COVID, according to the latest weekly data released by the province on Thursday. That brings the death toll for the current season up to 306. The latest data also shows an additional 177 people were hospitalized for COVID, including 14 admitted to intensive care units in the ICU. So COVID in Canada is going up, and it's probably the same likely throughout all of Canada, at least from what I am reading. All right, Philadelphia yesterday, 738 EMS incidents. New York State, we're skipping over New Jersey. I did not pull up New Jersey's data. It's kind of hard to see when I'm mobile. But New York State, 4,170 new cases, slightly down from yesterday, still over 4,000. That is not good. In the hospital, 1,840 people are in the hospital in New York State. That number is up from the previous day, so that is not good either. Then we go west just a little bit to Ohio, and Ohio is reporting that they had 14,395 cases. That is up from 13,215 cases. So, yeah, that's a rise, and I should note that for Ohio, they have had over 10,000 cases each week since late November. So Ohio's not doing well, and as we know, places will not. There you go. It's crazy out here in the wild. There's COVID everywhere. There's people being impatient. Just absolutely insane in the wild right now. But the point I'm trying to make here is Ohio cases will probably go over 15,000, and peak won't be until the first few weeks of January. Most states, at least in the East, will peak in early January. There will probably be some states in the United States that probably won't peak until maybe mid-January. We've seen this each year during the surges, where some of these states that are a little bit later to get going during the winter surge do not peak until maybe late January. Colorado may be a state, maybe one of the last states to finally peak, because as you saw yesterday, Colorado was rising, through most of the summer and most of fall, leveled off for about 3 weeks, and then they're just now starting to rise again. And as we know, any peak now for the majority of states should be higher than what we saw in the summertime, just because of what is going on right now. I mean, there are a lot of people sick right now. If I had a scale from 1 to 10 for a coughing meter, this is not good. I would say 7, 8. Yeah, I'm seeing a lot of people cough right now. And wait till next week. That meter's probably going to get close to 10 because there are a lot of people sick right now. And it's not even all COVID. I mean, COVID is really bad. COVID numbers are going up. Everything else is going up as well. Maybe flu numbers are slightly lower than where they were last year at this time. Is that going to last? No. Maybe it's going to probably go up higher for the next week. The thing that is probably surprising me the most so far this winter season of viruses is how bad RSV is getting. I'm hearing so many people say RSV is just hitting new levels not seen before. RSV levels are just through the roof. I mean, we see New York City. I saw a story recently about how bad RSV is getting locally around here. It's really bad. Something else that is getting relatively concerning, and this is a new report coming in from the CDC. Don't have it in my notes. I literally just saw this before I started recording here, is the fact that CDC is reporting children's hospitals right now, children's hospitals in America are already approaching the peak of the last winter's surge of viruses. That's bad. We're only in middle December. There's still 2 more weeks until we start seeing the peak of all these viruses. So, yeah, that's not a good thing, my friends. That's telling me ERs are going to, well, they're saying ERs are going to get swamped. Like, hello? Who could have expected this? It's one of them deals. You know how, oh, well, we didn't expect this to happen. Really? That's because you thought everything was fine and dandy, and you rushed back to normal again. All right, something else I'm noticing in the wild. This is actually a tiny bit of good news, but can also be bad news at the same time. Let me explain. I'm starting to see more people wear masks. I'm starting to see more people wear the correct mask. I've also seen a lot of the blue masks, but this winter I'm seeing more people in a high-quality N95 than last year. That's telling me COVID Twitter, or maybe here on YouTube. I don't know about myself. I'm not a huge channel. I mean, we're definitely a growing channel. Don't get me wrong. The channel here, we're growing big time over the past couple weeks because of the surge of viruses. People are searching it. But what I'm noticing is people are starting to become a little bit more educated. I'm seeing more people in the correct mask. Is it a lot of people? No, but it is a noticeable increase. The question is, why? Are they currently sick? Are they maybe trying to do the right thing before they go and visit relatives and family members over the next few weeks? Maybe I want to hope that's what it is, and maybe they're just trying to be cautious and they know that things are getting bad. Hopefully that's what it is, but hey, I'm seeing more people masked. It's not good enough. I want to see even more masking, but it's definitely a noticeable increase. Is it everywhere? It varies from place to place. Some places more than others. Definitely a big increase in the grocery store. And unfortunately, yes, I still see some people in the original day one pandemic cloth mask. Hello, please, if you're wearing a cloth mask and you're watching this video, get yourself a better mask. At least upgrade to surgical. Okay? Maybe you can't afford N95. I understand it. If I was a millionaire, I would be handing these masks out everywhere. I'm not a millionaire. But if I was, I would be giving them to all people who want them free of charge, because that's what needs to happen. But yes, I am definitely noticing more people masking right now, and I've noticed a big increase in the number of requests that I get on these apps. If you haven't been following me for a while, the reason why I'm out here in the wild today is because I do delivery services. Friday's a busy day, and Friday I don't have enough time to run home, get everything ready on the screen. You know, it actually, to go home and come back, that's actually sometimes a 2-hour ordeal. And sometimes it's not always peaceful and quiet at home. Well, out here in the wild, it's not always either as well. It's absolutely insane out here in the wild. Places are getting busier. Places are getting more crowded. More of the reason for you to mask. I am well stocked up with masks here in the car. This is just for this week. I constantly make sure I have at least, 6 or 7 masks on hand, because you never know if one's going to break, and well, time for another one. And I constantly bring more masks into the car with me. Alrighty, folks, that's really about all I have for today. The weekend's coming up. Maybe you have a holiday party after work today. Think twice about going to them holiday parties at the crowded bars and restaurants. It's really risky out there right now. As you know, we're doing over 1 million cases a day right now. And eventually we're going to do north of 1.5 million cases a day just in the United States alone. Around the world, we're talking tens of millions of cases a day. Maybe, I don't know. I honestly don't know how high the worldwide number is going to get. It's going to get really high. JN.1 is here. JN.1 is causing damage. Some are asking, is this going to be more severe? I can't answer that question. The best answer to give for that is, we won't know until after the wave if this ends up being more severe. What I can tell you is, please protect yourself as much as possible because deaths are already rising. The early indication, this is the early indication, I'm not going to go any further than this. The early indication is this is going to be a significant death wave because cases are still on the rise, and yet already we are quickly going to be approaching that 2,000 a week death mark. That's a bad sign. So the early sign is, yes, this is going to be a severe wave, but will it be a Delta wave? No. Will it be BA.1? Probably not, but that's all I'm going to say. I'm not going to guess or speculate any further. Just know that the fact deaths are rising right now. So you should take this serious. And those who have had COVID several times, please, if you get it again, it could be more severe for you. You don't know. Just don't think, well, I had COVID the first time and I was asymptomatic, so I'm not too concerned. No, it could be a complete different beast for you the next time. It could be severe. You could be getting crazy fatigue, shortness of breath. All kinds of things could happen. I know people who had COVID, and within just a week's time, they lost 20 pounds. That's nothing to sneeze at. And yes, COVID does cause runny nose and sneezing as well. Alrighty, folks, that does for today's pandemic update. We will have another update again tomorrow evening. We're not going to do our usual noontime Saturday update. It's going to be Saturday evening. Please, just stay safe. Have a safe weekend. Maybe you're going to be busy this weekend, and you won't be able to catch my updates. Do whatever you can to protect yourself because this is going to be a very risky time. Stores are going to be packed and cases are going to be going around left and right. COVID, flu, RSV, pneumonia, all of the respiratory viruses are on the rise and it's really risky. Protect yourself, protect your family, and be safe. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. Share this with anyone who needs to see this. If you got a thought, maybe you know someone who's positive, maybe you know something that you would like to be seen on the channel, maybe you would like to see me do a video about something, whatever it may be, leave a comment about it down below and I will do my best to respond. I will see you guys again next time. Until I see everyone again next time, stay safe, everyone. Have a safe weekend. Take care. See you all again next time.